Hi Mandy, it's Allie Rooney here. Here's my patient that I will be doing my head to toe on. So we're just gonna get started. First of all, I'm going to knock. I'm gonna wash my hands. I'm gonna enter, ask them a name, date of birth, something to identify themselves, and then I'm gonna provide privacy for them, and I'm gonna explain to them that I'm doing a head to toe assessment on you today, all right? So we are going to start with looking at their head. We're gonna inspect for parasites, lesions, bumps, and hair distribution. And then we're going to move till the optic nerve 2, the cranial nerve 2, which is the optic nerve. And this one we're going to do the confrontation test. So I'm going to have her put her hand over one eye, and I'm going to go put numbers up in 4 different quadrants. I'm going to have her follow my hand, and then we'll do the other side. And we're going to follow me in 4 different quadrants. Perfect. So then we're going to move to cranial nerve 3, which is the ocular motor nerve. And this one we are going to assess Perla, but before we do that, we're going to inspect your eyes for redness or any discharge. And then with Perla, we're going to take out our light, and I'm going to have her look at my light while I flash it in her eyes, that way. And we're just looking that the pupils are equal, round, and reactive. And then for accommodation, I just want you to look forward and then look at my finger to make sure that they are accommodating for it. Along with cranial nerve 3, we have cranial nerve 4 and 6. Cranial nerve 4 is the triacular, and that one triacular, and then cranial nerve 6 is the abducens. And for this one, we're going to do the 6 cardinal grays of field. So I'm just going to have her follow my finger. So just follow my finger with your eyes, please. Perfect. Then next we're going to look at the nose. We're looking at the nose for discharge. Then we're going to look for nasal patency. So I'm just going to have her close one nostril, breathe in, then close the other one, and breathe in. And then we're also looking for any devitations in the nose. Next we're going to move to cranial nerve 5 and 7. So that will be triangular and facial. So I'm going to have her close her eyes, and then I'm going to feel on both sides. Just make sure she feels it on both sides. And then for facial, I'm going to have her smile, frown, and puff out her cheeks. Perfect. Then we are going to move to cranial nerve 8, which is acoustic. And before she does cranial nerve 8, I'm just going to look at her external ear, make sure those discharge, lesions, nothing going on in the ear. And then with cranial nerve 8, I'm going to do the finger rubs next to her ears just so she hears me. And then we're going to move to cranial nerve 9, 10, and 12. And that is assessing your mouth. So the first one, cranial nerve 9, is the glossopharyngeal. And that one, I'm just going to have you swallow. Cranial nerve 10 is the vagus. So I'm going to have her open up, say ah, make sure the uvula is midline. Then I'm also looking for the mucous membranes and the general indentation condition. And then we are looking at cranial nerve 12, which is the hypoglossal. And that one, I'm going to have her stick out her tongue. And I'm going to make sure it's just midline. After that, we are going to move to cranial nerve 11. And so I'm just going to have her shoulders shrug. Perfect, and that's the accessory. Number 11 is accessory. Then I'm also going to have her go against my hands for resistance. Perfect. After that, I'm going to have her do range of motion. So I'm going to have her go side to side, rotate side to side, go lateral, which is this side, that side, and then up and down. Perfect. And then after that, we are going to move to the lymph nodes. So I will be palpating the lymph nodes, and you start with the tonsillar, which is right back here. Then we move to the submandibular right here. And then right under the chin right here is the submental. And then we are going to go to the pre-ocular ones, the post-ocular ones, and then the back is just the regular optical. And then we'll move down into the neck, and you have the anterior cervical, posterior cervical, and then right above the clavicle is the supraclavellaro. Perfect. After that, I am going to palpate her carotid artery. So I'm just going to go one side at a time, and we're just going to feel right here, then we're going to feel right here. Perfect. And then after that, I am going to take my stethoscope, and we're going to listen to a breathe. We're going to, can't hear with all these, but I'm just going to look with the bell side. And I'm going to have her breathe in, breathe out, and hold on each side. So we just breathe in, breathe out, and hold. Perfect. We'll do it on the other side. Perfect. Awesome. After that, we are going to move to looking at your thorax. So I'm just going to look at the shape of your thorax, and then we're going to move in, and then I'm going to compare that to your AP transverse diameter. So you're just looking at the sides, making sure everything looks good. Then we're going to move on to assessing respiratory rate, rhythm, and then you're going to look at the accessory like shoulder muscles, making sure those are good, and if she has a cough or anything like that. And then we are going to move in to turn around. Perfect. Then I'm just going to make sure that the spine is aligned and everything looks good there. I'm going to move in and take my hands to a butterfly shape and go right here, look for the thoracic expansion. That's just having her breathe in and breathe out. Perfect. And then I'm going to do the tactile femoris, and I'm just going to have you right here on my hands and have her say 99 every time I'm going down. And you're going to do that in 4 spots. And then I'm going to do the costovertebral angle, and I'm just going to percuss that for tenderness. So right here, percuss, right here, percuss. Perfect. And while I have her in the back, I'm just going to auscultate her breath sounds on each side. You're going to do 4 on each side. Go 1 here. And then you're going to have them breathe in and out, and you're going to also do that on the skin, but for this purposes we're not. And then I would just do the 2 axillary ones as well. Perfect. And that also would be on the skin, but right now we're not doing that, and they breathe in and out as well. So I'm actually going to have her flip around to the front, and while we're doing that, we're going to auscultate the front lung sounds, and that is 4 on each side as well. And then just breathe in and out. And then that would also be on the skin and having her breathe in and out, but for this we're not doing it. And then I'm also going to auscultate the heart while I have this right here. So we're going to start on her right side, and we're going to do the aortic, which is in the intercostal 2. And then we're going to do the pulmonic, which is on the left side on intercostal 2 as well. Then we move down to Erb's point on intercostal 3. And then in between 4 and 5, intercostal is the tricuspid. And then we move down right below number 5, and we have the mitral valve. Perfect. All right. After that, I am going to have her lay on down. Perfect. While she's laying, I'm just going to make sure that the abdomen has the right shape, everything looks good in there. I'm also going to ask her how her urinary and bowel movements have been, if there's been any problems or what her habits are, and then when she last had her last bowel movement. Next, we're going to move into auscultating her bowel sounds, and this you would really do on the skin, but in these purposes we can't. So you're going to look, and you're going to start in the right lower. So we're going to start here, and we're just auscultating for a bowel sound, and go to right upper, left upper, and right lower. We're just looking for tenderness and making sure it's not bloated or everything's looking good down there. And then after we're done auscultating, we're going to palpate lightly. And you're going to on that one too as well. Start on the right lower. Then you're going to move to the right upper, left upper, and right lower. Just make sure everything's feeling good in there. Everything's fine, no pain or anything's going on. After that, we are now going to move to doing her upper extremities. I'm just going to have you lay down, keep laying down. We're going to move to the upper, so I'm just assessing and looking for edema, tenderness, temperature, deformities, or lesions, just making sure everything looks good, everything's ready to go, and then we're going to move to the capillary refill. So I'm going to take her finger here, and I'm going to push down on it, make sure that the refill comes back, and then I'm going to do it on the other side. Same thing, you could do this finger and just make sure that the refill is there. After that, I'm going to move to range of motion. So I'm going to have her abduct her arm, flex, and extend. Perfect. And And for these terms, you would do it on both sides, but today we're just going to do it on one. Next, we are going to look for her, reflexes. So we're assessing the reflexes, and we're going to start with the radial umbrellus, which is right here. And you're kind of just looking to make sure that her hand moves. Then we are going to look for her bicep, which is right here. Make sure you get that going. Then you're going to look for her tricep down here and just make sure that the arm goes side to side. Perfect, and while they are laying down, you would have it across their body. Next, we're going to palpate and locate their pulses. So right here, and you would do that on both sides as well, the reflexes and the range of motion. They're going to palpate starting with the radial, and then you're going to move up to the brachial. And then you're going to do that on both sides. And you're just looking for symmetry and strength of those as well. And then we're going to take her fingers, and I'm going to have her squeeze my fingers. And then this is assessing for strength. So then we're going to do the push and pull. And then on this side as well, do the push and pull. Just make sure that she has everything good there. After that, we are now going to move down to the lower extremities. We are going to just look for well and inspect for edema, temperature, tenderness, deformities, and lesions. Make sure everything's good. And then there as well, we're going to start and do the, make sure she has her strength. So I'm going to have her push against for the plantar, and then push down on mine for the, dorsal. So the plantar and the dorsal. And then we're going to do range of motion. So I'm going to have her do abduction, abduction, flexion, and extension. Perfect. And then on this side, you would do the exact same. Now next, we're going to do the reflexes. So we're going to start with the plantar, which is right below the knee. And I'm just looking for her to kind of kick at me. So we're going to do that. We're looking for the kick. We're doing it here and look for the kick. And then we're going to go to the Achilles, which is right behind here. And we're going to kick there. Make sure that foot just kind of jerks up. Right here, the Achilles, make sure that foot just kind of jerks up. And then we're going to do the plantar, which is right here. And you use the bottom of this. And you're just going to go from the heel all the way around. Make sure their toes flex. Then the same on this side. You're going to go all the way around and make sure that the toes flex in and down. Then we're going to move to their pulses. So you have the popliteal right under her knee on each side. Perfect. And then you have on right here, you have the posterior, if you can see, posterior tibial right here. And then right in between the toes right here on both sides, you have the dorsipedis, and that's right in between the toes there. And then while we're down here, we're going to look for the capillary refill in the toes. So you're going to use both toes here and make sure that you're getting the refill on those. Perfect. And then I'm going to have you stand on up. Now make sure she's comfortable. She has everything she needs. Oh, before we do that, I'm going to have her inspect the gait and her balance and gait. So for her gait, I'm just going to have her walk forward, walk backwards, then face forward. And then for her balance, we're going to do the Romberg test. So I'm going to have her close her eyes, put your feet together, arms out, and just make sure she doesn't sway. Perfect. Good job. Well, then I'm going to have her sit down and make sure she has her call light, her belongings, anything she needs. Make sure she's comfortable. Wash my hands, and we are all done.